Hello, I'm Kimberly Giden, and today we're going to be talking about reconstitution, or reconstituting a powder to a liquid. And I know it sounds like a big word, but it's not as big as you think it is, because we do reconstitutes every day in our everyday life. And what I mean is just simply changing one form of something from one thing to another. For instance, this is a powder. What we're going to do is change it from a powder to a liquid where it'll be an active drug. This is not a real medication, this is a fake powder. In the medicine world, this is called amoxicillin, which is an antibiotic used to treat infections. Okay? And in our world, in the pharmacy world, it comes to our pharmacy in a powder form. Okay, so what we're going to do is we're going to take the powder and we're going to change it to a liquid. And it's got a good storage life of about 2, maybe 3 years on the shelf. Once you mix it, however, mix it with a certain kind of liquid, not necessarily water, but it just depends on what the drug is. Once you mix it, it changes the shelf life of the drug. Okay? So what we're going to do is, the first thing you want to do is read the directions. The directions simply says to add 119 milliliters of water to the powder. This is very simple. We're going to take the bottle, we're going to tap it to loosen the powder. You have to do this each and every time before you mix it, because some of the powder is really caked in and really solid. So if you don't shake it apart, when you try to add the water to it, it's just going to sit on top of it, which is what we do not want. So you shake it, tap it around, and then we're going to mix it. It calls for 119 mLs of water. This measures out exactly 119 mLs. And in particular, just in case you're wondering why am I using the bottled water, it's because in the pharmacy world, we have to use distilled water with nothing added to it. It has to be very pure in its purest form. Okay? Once you get it that way, let's top back on. We're going to shake it. Okay? Shake it vigorously because, again, we do not want powder to be on each end of the bottle. We want it to be all mixed properly. Give it a good whack. As a technician, you want to open the bottle back up. You want to check this top, make sure there's no powder there. And then you want to check the actual liquid to make sure there's nothing floating, there's no odd colors. Make sure that it is completely mixed. If you want, you can place the top back on, flip it upside down. As you can see, I still have some powder pieces there, so we go back to the vigorous shaking once again, because you do not want to give a powder form to a mother, to anyone for that matter, a patient, a sick patient, and it's not mixed properly. If you add less than what the product is requiring, less than 119 mLs of water, then you're going to give it too concentrated or too strong to the patient, which is not good. If you add more than it was required, more than 119 mLs, then you're going to dilute it, which is not good. We need it to be exactly the way the package says it should be. Okay? Once you get through mixing it, again, it's okay. You got a couple of minutes to shake it up, because we want to be right. We don't want to be fast. We want to be accurate. And as you can see, now it's pretty smooth. There's nothing floating. I check my product once again. There's nothing floating in it. There's no odd coloring to it. You can even do a whiff smell like so to make sure there's no odd smells to it, because sometimes we get things that come to us that's not always good. After everything checks out, we close it back, and then we usually take a prescription label and place it on the end. Like usually on this side, you do not want to take the prescription label and place it on this side of the bottle, because you don't want to cover up the expiration date. We want all expiration dates to be exposed to the patient, so they can always know what's going on. Okay? Once you place the label on the bottle, you instruct the pharmacist to remind the patient that once we mix this, the shelf life is no longer the powder life, which is on the bottle for a couple of years. Now the shelf life of this new liquid is for 14 days. So 14 days from today, this drug is no longer good. And make sure you let the patient know that they need to keep this particular product refrigerated. How do I know? Read the package. It'll tell you everything, how to treat this drug accordingly. Okay? Once you get done with that, this is called a reconstituted product. My name is Kimberly Giden. I hope you learned a little something from me. And remember that all antibiotics are not created equal. So read each package prior to mixing. Thank you.